So today we're going to talk about diabetes. And diabetes is when the body is unable to use blood sugar or blood glucose properly. Now, blood glucose or blood sugar is interchangeable. It means the exact same thing. It's our main source of energy and comes from the food that we eat. Diabetes occurs when this form of energy is too high in our bloodstream. And our natural insulin that our body produces from our pancreas is a hormone. And that hormone helps glucose from the food get into our cells to be used as energy. Essentially, insulin regulates glucose. Okay. Now, sometimes our pancreas doesn't make enough insulin or it doesn't know how to use it well. So that glucose tends to stay in our bloodstream and it starts to build up. And then you start to feel the inflammation, which leads to the diabetic ailments and symptoms. Either it's a factor of your cells unable to respond to the pancreas and the insulin, or it's just pancreas issues. Either way, this can cause insulin resistance or a lack of insulin in your body. Now, the main culprit that is included in diabetes is insulin. Period. We need insulin in order to regulate our glucose levels. And we do not always immediately use the energy that we get from that meal. So insulin also helps the body to store that glucose in the liver. And whenever we need it, that liver releases that energy to say, okay, here you go. And insulin ensures that the levels of blood sugar remain within the certain limits, stopping them from rising too high or falling too low. So if we do not have the proper insulin or a lack of, this causes blood sugar spikes or decreases, and this is what leads to diabetic issues. Now, what causes insufficient insulin production is excess body fat, obesity, especially around the belly or organs. This is the primary cause of insulin resistance. Belly fat makes hormones and other substances that can contribute to long-term inflammation in your body. This inflammation plays a role in insulin resistance. And also, a lack of physical exercise can make your body unresponsive to insulin. Diet that's high in processed foods, carbs, is also linked to insulin resistance because your body digests highly processed high carb foods very quickly. And this causes your blood sugar levels to spike. Imagine putting this sort of food in your mouth every single day. This puts extra stress on the pancreas. Let's just say you're eating a burger every day from McDonald's and that's your lunch. Monday through Friday around 12 o'clock, you go get a burger and some fries. That's highly processed foods. It's high in carbs, So we're constantly putting this in our body 5 days out of the week. That means that your body is breaking that food down very quickly, causing your blood sugar levels to spike. And if you're constantly at a spike and your blood sugar levels stay up, it's putting extra pressure on that pancreas to produce insulin because we have got to get these toxins out of our body. This causes the insulin to slow down. It causes insufficient insulin in our body. It causes our buildup of blood sugar in our bloodstream to where we start to have those ailments because, diabetes and things like that don't happen overnight. It happens over time, just like any other ailment, any other diagnosis. It happens over time with the food that we eat, lack of exercise, etc. And fun fact, in 2019, there was over $10.42 billion in revenue in the insulin market of, the chemical insulin that they make in the lab. There was a $10.42 billion revenue in the USA. And now they're talking about insulin prices are on the rise. Why? Because they know that the ordinary person relies on the doctor. So they go to the doctor tells them what pills to get on, what shots to get on, what liquids they need to take. And because of that, the people are going out and getting the prescriptions And so the pharmaceutical companies are raising the prices because they know what they're doing. It's all planned for you guys to buy into this Western medicine, this Western society of buying whatever they tell you to buy because they can raise the prices on it whenever they want to. But you don't have to do that. That's just like the medications that they are prescribing, just like insulin. You have, number one is Metformin. Now, I've heard of Metformin. It helps to control blood sugar levels. It also lessens the amount of sugar the body produces and absorbs. Now, Metformin was recalled between 2019 and 2021 for having cancerous chemicals found in the pill. Now, 2021 was last year, and also I'm pretty sure there's still cancerous chemicals and other things found in those pills. The side effects of Metformin include, and this is a long one, unusual muscle pain, feeling cold, trouble breathing, feeling dizzy, lightheaded, tired, irregular heart rate, diarrhea, fast, shallow breathing, chest discomfort, depression, increased hunger, headaches, seizures, slurred speech, behavior changes, mood swings, difficulty concentrating, a loss of strength, restless sleep, agitation, flatulence, gas, lactic acidosis. Now, hold on a second, because lactic acidosis is one of the long-term effects of taking metformin, and also a lot of the diabetic medication that they prescribe. Now, lactic acidosis is this form of metabolic acid, and this begins when a person overproduces or underproduces lactic acid. Now, you may have problems with your liver or kidneys being able to remove excess acid from your body. That's lactic acidosis. Lactic acid assists in cell respiration, glucose production, and is very important to the body's function. But when you have too much of this from the medications that they're prescribing, you get problems with your liver and kidneys being able to remove excess acid from your body. And you need your liver and your kidneys to work at all times to remove any acid, toxins, anything that's not supposed to be in your body. We need that. That's essential for living day to day. And if you're prescribed this drug, it said that you will be on it for decades because that's the way they made it. Now, lastly, there's a risk of developing Alzheimer's. It also causes anemia. It interferes with the absorption of vitamin B12 in the body. So your body is not able to absorb the nutrition and the vitamins that it needs. Also, it contributes to nerve damage, neuropathy, which can cause chronic nerve pain. That's all from one prescribed medication, and it's the number one prescribed medication for diabetic patients. Number two is insulin, and not the natural insulin that I said comes from your pancreas. The insulin that they make in the lab to try to make your pancreas seem like it's insulin in there, but it's not. And of course, insulin is exactly what your body makes. It helps to regulate your blood glucose. Now, the side effects of the man-made insulin includes redness at the site, swelling, weight gain, constipation, rashes and itching all over your body, shortness of breath, wheezing, dizziness, fast heartbeats, difficulty breathing, swallowing, muscle cramps, a large weight gain in a short period of time, swelling of the arms, hands, feet, ankles, increased risk of cardiovascular events, mortality, cancer, high risks of very low blood sugar reactions, and over time, it leads to kidney disease and kidney failure. Low blood sugar, anxiety, depression, twitching muscles. Also, increased risk of a heart attack, of a stroke, eye complications, low sugar levels, lower than normal, digestive issues. This man-made insulin that's supposed to replace our natural insulin gives several reasons why you should make sure you are taking care of your body, because all of these side effects are because of chemicals that's placed into your body that is unknown. And when any substance that's unknown, your body is going to kick into overdrive, trying to figure out what to do with it, which is why you have the rashes and the swelling and all of those things, because your body is it's basically freaking out in a sense. Number 3, and not necessarily the most popular, but is a medication that I stumbled upon in my research, and it was glipizide. This causes the pancreas to produce insulin. So, this causes headaches, irritability, diarrhea, constipation, tremors, skin rash, burning in your body, numbness, prickling like pins and needles, blurred vision, confusion. Then you have difficulty moving legs, difficulty moving any limb of your body, muscle pain, stiffness, nervousness, slurred speech, swollen joints, unusual tiredness or weakness, swollen glands, severe stomach pain, tightness in your chest, painful urination, vomiting, jaundice, weight gain, hair loss, bleeding of the stomach or intestines, liver failure, low blood sodium, red blood cell production comes to a complete stop, inflammation of the liver, premature disruptions of the blood cells, red blood cells, a flow of bile stops from the liver, and we need bile because that helps to break down our food. And it also says that even more serious health conditions may arise. I don't know about you, but this sounds like serious health conditions. So they're saying that there's even more serious health conditions that may arise from this medication that they prescribe. And the fact that they know this and they still give you prescriptions to go and get it. Number 4 is a medication called Invokana, okay? This causes dehydration, hypotension, lower limb amputations if it's not used properly or used for too long, a risk of broken bones, serious UTIs, increased kidney damage, dry mouth, constipation, nausea. It says serious infections of the genital areas, allergic reactions, kidney damage, bad cholesterol, confusion, excessive thirst. And number 5 is Galvus. Haven't really heard of these two. Kind of heard of Invokana on a commercial maybe a couple years ago, but they're not as popular as the first 3 that I've mentioned. And Galvus causes swelling of the hands, feet, weakness, dizziness, headaches, things like that. Same exact side effects, peeling of the skin, joint pain, excessive sweating, same long-term effects. And it also says that stopping either one of these medications may cause your symptoms to grow worse. So they put you on the medication for diabetes. You have very serious complications from the medication. And then they tell you that if you stop this medication, it will cause your symptoms to grow even worse. And these medications bind to our blood cells, inside or outside of the blood cells, and forces that cell to act naturally. They mimic the natural production of insulin or, the pancreas production to create the same effects as our natural state in our natural body. And this compound releases into the blood, kind of kickstarting your body with whatever chemical they've placed in these pills. So essentially, they're tricking your body into doing things that it's not wanting to do on its own. No harm could come from that, right? All we have to do is get down to the root of why our body won't produce insulin on its own. There's always a root cause of why. And if you have certain things like diabetes that run in your family, then you know that, okay, I know I have to make sure that I'm eating right, that I'm actually exercising and maintaining and looking at natural remedies and holistic medication so that I am able to maintain on my own. And you know that even if it doesn't run in your family, you still have to be mindful. You know, you can't go out and eat fast food every single day or eat like you want to every single day, because you have to be mindful of the way that your organs work and the way that your body works. Your body has to go into overdrive if you're constantly putting any type of toxins or any substances that do not belong. We have responsibilities, you know, for this temple that God gave us to take care of it the best way that we can. And that does not mean running to a doctor. And if you have already went to a doctor and gotten on these medications and you're seeing the side effects and you're trying to get off of them, then here are some holistic remedies that you can use. Most of these remedies that I will speak of can be found in supplements, powders, juices, and they can be incorporated with your food. These are God-given seeds, herbs, trees that He made for us to use solely for medicinal purposes. Now, I'm going to start with Fenugreek Seed. Don't know if anyone has heard of that. I've heard of it and I've seen them, but really didn't know about the health benefits of them until, of course, I started to look them up. And Fenugreek Seed helps to lower blood sugar levels. It contains fibers and chemicals that help to slow down the digestion of certain carbs and sugars. This herb can be ground into powder, and it can be used in a supplement if, you know, that's what you would like to do. Now, understand that whatever you take, whether, you know, holistically, whether it's a supplement or just apple cider vinegar, it does take your body time to react. It takes your body time to detox those toxins out, especially to detox those medications out. So you have to be patient in allowing your body to get back to its natural state of things. Next is Neem, or curry leaves. It's a leaf that's found in Asia from a curry tree. And it also helps to manage your blood sugar levels. And you can consume this powder by supplement, put it in your tea, smoothie, whatever you would like to do. A lot of people just go out and buy the little supplement capsules and they fill those capsules up with powders and seem to take it a little bit better like that, but it works. Curcumin is number 3, and that's found in turmeric. Turmeric helps to boost your blood sugar control. Now, it's not the tastiest spice in the world, and it comes from India. They tend to sprinkle theirs on in their food or just in any recipe really, but it can be taken as a supplement. And I personally would suggest that you just take it in a supplement because it does have a nice little bitter aftertaste. It takes a while for your palate to get used to it. So that's turmeric. Apple cider vinegar. Somehow apple cider vinegar turns up in almost every holistic remedy because it's just that powerful. But apple cider vinegar is something that you can take before bed, 2 tablespoons mixed in a glass of water, like I've said before, to try to make it taste good, or even putting it in your tea or something. And it can reduce your morning blood sugar levels. So if you take it right before bed, it has time overnight to work in your body, and then whenever you get up in the morning, your blood sugar levels should be reduced and should be maintaining at a steady pace. You can use this, of course, in your tea, salad dressings, things of that nature. Aloe Vera. This is known for its laxative effect, and if you use the sap of the aloe vera, it helps to protect and repair the cells of the pancreas that produces insulin. It lowers the levels of glucose and increases your insulin levels. So, if your body has stopped producing insulin or can't produce it for some sort of reason, or it has insufficient insulin, aloe vera will protect and repair the cells of that pancreas to get it back to producing those insulin levels like it's supposed to, because insulin is the main culprit of diabetes. Cinnamon is next. And this cinnamon spice, you know, is something that we've all had on our sweet potatoes or dessert we've enjoyed, but we don't understand the benefits of it. Now, cinnamon, of course, is a spice that comes from the bark of a tree, but it can improve the levels of glucose, insulin, and insulin sensitivity in your body. Fats in the blood, it can be found in supplements. Or you can just buy some cinnamon. Put it in your tea. Make it work for you. Also, bitter melon, which is grown in Asia. And they say that it tastes really bitter, but you can also find this in supplements. But just think about the benefits of some of these things whenever you're taking them, because they're not all going to taste like, rainbows and strawberries. Sometimes you're going to have to endure a little bitterness, but it's good for you. So that's what you keep in mind. Now, bitter melon manages blood glucose levels. Next is milk thistle. And side note, milk thistle is something that you can take for your liver as well if it needs to detox. But milk thistle is found in the Mediterranean countries. It is a flowering herb that is related to the daisy. And there's a property in the milk thistle called silymarin. I could be saying that wrong, but it's silymarin, I believe. And that is the extract from the milk thistle. Now, this compound has anti-inflammatory properties and it lowers your blood glucose levels. Next is Gamnema, which is a herb from India. And this herb, the name of it means the sugar destroyer. Which it's a ground leaf or a leaf extract. It lowers blood sugar and it increases insulin production. Gamnema. I've seen it sold in supplement capsules, so I would look for that if you would like to. And lastly, ginger, which of course is found in every local grocery store you can think of, almost. It treats inflammatory issues, it lowers your blood sugar levels, and it also reduces insulin resistance. Yep. You can find it in tea, supplements, ginger ale. Just go get the root from the grocery store and boil it, like I've told you guys before to do. But all of these holistic remedies, holistic supplements from herbs and trees, God-given medicinal properties are good for your pancreas, insulin, diabetes, because you have to think about certain things. When we're talking about diabetes or any other type of ailment that messes with your body, what's the root cause of whatever's going on? I always think about that whenever I'm looking something up or trying to figure out something. What's the root cause? Because people always say, well, I have diabetes, and I've been having it for 5 years and I'm on Metformin and things of that nature. Okay, well, what's the root cause of your diabetes? Okay, you ever think about what the root is? You ever think about whether it's the fact that your cells aren't able to receive that insulin, and why can't they receive the insulin? Or the fact that maybe your pancreas isn't producing enough insulin, and why that is? Or maybe your pancreas just stopped producing insulin at all, but why? Is it because you're a little bit overweight? Is it because you have a little bit of belly fat? Is it because you have a lack of exercise and you're not using that energy or that sugar properly? Is it because of what you're putting into your mouth because of the high processed foods? And so your pancreas is in overdrive all of the time, and it causes the ailments that causes the diagnosis. Let's get to the root. And so these ailments that occurs, they don't have to. If we all get to the root of the problem, we can knock out everything else. What holistic remedy can you use to help your body to produce insulin now, right? Aloe vera. Go to the store, pay $2 to get you a leaf of aloe vera. Or go get some aloe vera juice that's majority, like 99% natural, and start to drink that every day. That gets to the root of the problem because it starts to help your pancreas and help the insulin. Now, granted, because you're changing over from a medication to a holistic remedy, then yes, that medication, of course, has to get out of your body. You have to detox it. You have to get it out because we don't know what that stuff is doing to you. Well, we know about the side effects, but even more so, there's so much more that those chemicals are doing to your body that you don't even know of. So getting to the root of any problem instead of masking it or trying to trick your body or trying to make your cells do something that they don't want to do. Let's try to make them do things naturally. You shouldn't want to mask any ailment in your body with any type of medication because that medication isn't doing you any good. So hopefully the breakdown of the diabetes complications, the pancreas and the insulin kind of helps you get to more of an understanding of what the root problems are when it comes to diabetic complications and how you can combat them. You can fix it on your own naturally. So they put all those big doctorate terms in the paperwork and in the doctor's offices that you don't understand because they don't want you to understand it. They want you to trust them enough to go and get on all of these medications that you don't need, to continually feed the pockets of the pharmaceutical companies so that the pharmaceutical companies can continually feed their pockets. Okay, let's remember that. It's always something behind everything. So let's start to move off of these medications. If you are on them, if you know someone who is on them, let them know that what they're putting into their body is truly causing detrimental effects. Help them to see that there are holistic natural remedies and natural ways of healing through the food that God created. I hope that this video helps someone. I will link my information in the description box. Please reach out if you have any questions, comments, concerns. Thank you guys so much. I hope you have a great rest of your week.